In this episode of The Next Stage, we continue our series on pivoting. During a global pandemic, what does a health and wellness center do to keep up with the needs of a population that was already struggling? Northern Nevada Hopes recognizes the needs of many in our community. They were already providing affordable health care, behavioral health services, and community support. During COVID-19, Northern Nevada Hopes recognized the needs of the community were shifting, and they pivoted to meet those needs. Sharon, Hopes was already a vital resource here in Northern Nevada. You were already assisting those that were either underinsured or without insurance. When COVID-19 happened, what were some of the new needs that you were starting to see?
You know, a big piece of it is that we saw the same needs, but we saw it expand to a population that hadn't ever needed to access those kinds of services before. Perhaps they'd never needed to because they had jobs and then they got their hours cut, or they got their insurance cut, or they lost their jobs and they were in a really hard place. I also think housing is going to become such a real challenge and issue in our community. You know, as people begin to lose the stability of housing, their health changes, and both behavioral health, mental health, but as well as their physical health, because when you're looking and trying to find just a place to stay for the night and those things, often what you let go is some of your more chronic health conditions that you've been maintaining and managing very well now start to take a second seat.
Is there a silver lining in all of this as you have pivoted and changed to meet the needs of the community?
I think there is a silver lining, and that's so important in this time because it can feel so dark, right? And so being able to have this, this thing that has really come to be a benefit for us, which is telehealth. Those services and being able to really expand, have a lot of our employees working from home safely now and offering behavioral health and psychiatry services, having our medical services going to telehealth. It's just helped create access. And so not only for people that maybe don't want to come in because of COVID-19, or maybe they're symptomatic and we want to make sure that we see them in the parking lot or over a telehealth visit, but also for people that have faced barriers, which we're seeing more and more of, in transportation, just being able to make it to the clinic. And so it really is, it's a new way for people to be able to access care, and it's really taken off. But I anticipate that as we expand telehealth, we'll also be able to expand the area that we serve, and maybe even more into the rural areas where people will have access to providers that they haven't had access to before.
We just want to say thank you so much. You have an amazing team. This is a beautiful facility, and I really see Hopes being a vital part of this community for a very long time to come.
Thank you so much. Thank you so much.